Hello lovelies. Sticking with my tradition of steering clear of difficult or contentious topics, today I want to talk to you about healthcare. But I want to talk to Americans about their healthcare problems and their healthcare system. There are issues with the NHS, don't get me wrong, but I just find the typical American position on healthcare that I run into online to be utterly perplexing. I begin to suspect that America itself might be some sort of death cult. You've got people fighting really hard to keep personal firearms that, well, the statistics suggest are profoundly unhelpful and cause more harm than good, but you know, that's statistics, people don't trust them. Tough, there's a lot of statistics in this video. But they also fight almost equally hard not to be given the provision of healthcare. So they fight for the ability to murder themselves and each other, and against the ability to live longer, healthier lives in a more cost-effective fashion. And it just doesn't make a lot of sense to anybody looking in from a different healthcare system, other than a few wealthy people over here who want to profit more from the healthcare system. And I think that cuts to the crux of it. Americans are utterly wedded to capitalism. Capitalism's great for a lot of things. I don't advocate Marxism, I advocate for socialism and a mixed economy. But capitalism is as terrible for some things as it is good for others. Large infrastructure projects are much better handled in a sort of centralised governmental way. Healthcare. Because really, when you get ill, you don't have any real choice, do you? You have to get treatment. And it can get very expensive, but you have no choice. So people are going into bankruptcy and selling off all their assets and all their property, ending up jobless, homeless, all the rest of it to stay alive. And some people will just say, tough, them's the breaks. I don't think so. I think we have a responsibility to each other to provision each other with a right to at least basic healthcare. Americans seem particularly concerned about the cost. There's this weird idea that private healthcare competition somehow keeps the prices low, except here you have a captive market. Yeah, it's a seller's market, utterly. And the sick person doesn't have a great deal of leverage here. You're sick, you have a problem, you want it treated, you don't really have much of a choice. It's a bit like cable providers, who often have monopolies, even though the market might be capitalistic. They have a monopoly over a particular area, and so no matter how shitty their service or how expensive it is, you're kind of locked into them. And it's kind of not dissimilar. But this doesn't make sense to me at all, because cost is where the differences are perhaps most stark. The UK, combined, per person, both public spending on healthcare and private spending on healthcare, we'll get to that in a sec, we're at about number 18 in the World Health Organization medical rankings, right? That's about $3,750 per person, combined public and private spending. The USA comes in at around 37th in the rankings, and if I remember correctly from the last time I checked this, every single healthcare system that ranks higher than the US is a public healthcare system. But in the USA, you spend, combined, public and private, about $10,000 per head. So, yeah, roughly 3 times as much as we do for a service that only puts you in at around 37th. And the outcomes aren't that much different on aggregate. You're about roughly as likely to survive whatever it is that ails you in the UK as you are in the US. There are differences when you drill down to specific cancers, things like that. And outcomes are better in the US if you can afford to pay, but in aggregate, on the whole, you're getting roughly the same survival chances, but a worse overall healthcare system for around 3 times the cost. And that's after the Affordable Care Act, which helped a lot of people, got a lot more people covered, but also screwed over a lot of people whose premiums and so on went up. So It's better overall under the Affordable Care Act, but it's not any kind of real solution. It's just kind of tinkering at the edges and hoping that will tide you over. People say that's not a good comparison. The UK is a very highly populated, sort of dense area, right? Whereas the USA has big rural areas, people spread out all over the place. Yeah, that's a fair point, I would suppose. So let's go and have a look at Australia, right? Australia has very few big urban hubs. A lot of it is spread out. They had to innovate. They had to do a lot of things differently in order to provide healthcare for people in the outback. Hence the Flying Doctor, which I think was a soap opera series for a while, but it's a real thing. And now they're innovating in the use of drones to deliver medicine to more remote locations. So in many ways, Australia is even more difficult to provide universal healthcare in than the USA, but they have publicly funded healthcare. They're about 32nd in the WHO rankings, so not the best, but still better than the US. And what do they spend? About $4,500 per head. Still cheaper, still get a much better healthcare service than the USA does. So how is this happening, right? Competition is supposed to keep prices low and drive innovation and so on, but a lot of that the innovation actually comes from universities and government funded research and so on as well, so that's not really balancing things. In the USA, the insurers and everybody know they have a captive market, and they will gouge you and they will charge you the maximum amount that they can. In places with a public healthcare option, they have a duty to charge the smallest amount possible, and they're directly democratically accountable. If we want to spend more taxation on our healthcare service, we can agitate for it, we can vote for it, all the rest. You can't do that with companies, unless you're a shareholder, which most people aren't. And there's knock-on economic benefits to having a universal healthcare system that you won't see in these statistics. It drives down the cost of private care. I could top up my public healthcare option relatively cheaply, as low as £20 to £30 a month for a very basic private healthcare plan, and then I would be able to jump queues and so on for small operations. I think I was on private healthcare when I had my wisdom teeth done. It was just quicker and easier to get it done privately because it was causing me havoc, But I could have waited. It wasn't the end of the world if I had to wait for that operation, but we just wanted to get it done and out of the way. But the fact that there is an underlying public healthcare sector that takes care of so much, that drives down the cost of private care, making it more affordable to everyone. So there's a knock-on benefit there that you don't necessarily see in those bold spending statistics. You don't have people going bankrupt under a public healthcare system. You don't have people delaying treatment. Right? A big thing I run into a lot online with Americans is, I'm really ill, these are my symptoms. And then people will come in and they will offer folk remedies in the comments, while naive Europeans and people from the more civilized world are saying, why don't you just go to the doctor? I can't afford it. What do you mean you can't afford it? You have to pay to see your family doctor, to see your GP? What are you talking about? We just don't grok it. But these people can be genuinely very ill, and they're just trying to get by on folk remedies and exercise and positive thinking and so on. That carries a lot of hidden expense, because if you don't go to the doctor early, get a diagnosis early, you might have something seriously wrong with you, which will continue to get worse, less treatable, and so outcomes become worse and cost to treat becomes higher over time. So it's better to have people go to the doctor. You also lose a lot of work hours and so on, because people who are perpetually sick but can't afford healthcare will have to take sick days off work. That increases strain on the overall system, less money is made, less good for business, and so on. So even if you're a conservative, if you're a fiscal conservative, public healthcare makes a huge amount of sense. You're not carrying the burden of offering healthcare options to your workers, the insurance and so on, and whatever else. You don't have to bump up salaries so much to cover the cost. You don't lose so many worker hours. Your workers are going to live healthier, longer lives, and they're going to put that into your business. So that there's a whole raft of other economic benefits that go with this. Okay, so why is it so much cheaper, a public healthcare option? Mostly it's to do with the economy of scale, right? If you buy 100,000 ball bearings, right, the per unit cost is a lot lower than if you're buying a pack of 10 ball bearings, right? It's got shipping, packaging, people can shave their profits right down on a per ball bearing basis and so on. Or if you want a more graspable example, though all analogies break down under close examination, consider when you're hanging out with your friends, right, and you order pizza. Now, if you all order an individual 6-inch pizza or whatever, you can get exactly the toppings and so on you want, but the overall amount of pizza is going to be a lot less. Yeah? You're paying more per slice. Whereas if you club together, if you use coupons, you get a special, you will tend to get much more pizza at a much cheaper per slice price, and something that everyone can at least cope with eating. And so it goes with healthcare, right? It's very good at providing very broad healthcare options for everybody, but not necessarily the tight specialized care that's necessary for some people. Though if you've got a big enough system and there's enough people that need these specialized care options, yeah, it's there, it's available. And the NHS can even subsidize private care if you need really specialist treatment, and that does happen. Do doctors earn less? This is actually quite difficult to work out because the pound has been in free fall lately due to Brexit. Now, it is true, it seems that doctors get paid less, but it's still a very worthwhile profession to go into. I looked this up as best I could, but do bear in mind that the pound has tanked lately. So apparently in the US, the average general practitioner, the average family doctor, earns around $165,000. In the UK, it's about $90,000. That's at the current exchange rate. If we go back to the more typical exchange rate, then I think they're only about $20,000 to $30,000 down on the US GP. But that's still a hell of an income, right? It's still a good whack of money that you'll be earning as a doctor. So I don't see that that's necessarily the problem. It's not like it's slave wages or anything. Some people seem to think that doctors and nurses somehow magically become slaves if you introduce a public healthcare option. I'm not really sure where they get that idea from. It makes no sense. It's still a skill that you've invested time and money in developing, and in healthcare professions it's usually something that people feel a calling to, right? And you get paid. So I don't see what's going on there. And there is still private healthcare here. Having a public healthcare option doesn't have to eliminate private healthcare. Might be better if it did, because there'd be more money then available for the National Health Service, but it doesn't have to. Some people seem to think that it does mean that, including some people who are advocating for nationalised, socialised healthcare in the US also seem to think that it means the end of private healthcare. It doesn't have to. It doesn't mean that in practice in most countries where it's done. So the UK and US overall tax rate is roughly similar. It's around a third of your total income if you're an average taxpayer, something around that. And healthcare is about 20% of our current tax bill here in the UK. This is in case you're worried about tax bills going up. So on a typical income, this is a couple of years back, but can't remember whether it's average, median or mean, but a typical income of around $30,000 a month. So we're paying about $1,200 in tax on healthcare. A lot of people don't have private healthcare, so that is your essentially most, if not all, of your total healthcare bill per year. You do have to pay for prescriptions, but that's about it. We could afford to put that up without it having a huge negative impact on people's lives. We could plough a lot more money into the NHS. There are issues like waiting times and so on, but apparently US waiting times are rising rather rapidly. We generally don't have to wait as long to see our family doctor, our GP. You're waiting around a month on average, I think, from the statistics that I saw. We're typically waiting a couple of weeks, if that, and if you have emergency appointments you can go in. But because our GPs are more accessible, we're not putting as much strain on the emergency room. In the US, it seems like a lot of people don't bother trying to see their doctor, they just go to the emergency room. I guess because that way you get triage. But the NHS as a whole is based on triage. It's the person in the most need goes to the head of the queue, not the person with the weightiest pocketbook, right? Not the person with the most cash in their pocket. And that's how you should run a healthcare system, right? That's how the military does it. Treat the people you can treat, with the hardest wounds as quickly as possible, and then work your way down to the others. That's the way that makes sense. That's the humanitarian way to do it, not the person who can give you the most money. So it just doesn't make any sense to us to look at the US, to look at the horror stories of people with illnesses going untreated, or refusing to go to the doctor because they don't want to pay out, or going bankrupt, dying in the street later, even if they have managed to afford to get something done, or people being dumped from one hospital to another because that hospital doesn't want to pick up the charge because they know that person can't pay for the treatment that they're still obligated somewhat to give them. It's a nightmare system. It's an expensive system. It's a ruinously expensive system, and it needn't be. And even places like the UK, we could make our healthcare systems a lot cheaper and a lot more effective. All across South America, one of the few positive things that the communist government of Cuba has ever brought in is their approach to healthcare, which is to have free, open clinics based around the idea of preventative care, because that is the most cost-effective way to do things. If you've got free, open clinics that anyone can go to without charge whenever they're presenting any sort of symptoms, then you can nip a lot of these illnesses in the bud, and then treatment is cheaper. You can even prevent it getting to the point where it becomes a truly terrible illness. So we could all stand to learn from that and save even more money. And then there's tech innovations, but that would be a whole other video about algorithms and deep learning AI and all that kind of thing. But look, it's not bringing in slavery to make healthcare a right. It's cheaper to have a socialised healthcare system. It's more effective to have a socialised healthcare system. A socialised healthcare system drives down the price of top-up private care. Doctors don't earn a fantastic amount less. Nurses don't earn a fantastic amount less than they do under a private system. It's just a no-brainer, no matter which side of the political divide you happen to come from. It's the approach that makes the most sense overall. That's the most cost-effective one. The statistics show it, the science shows it, common sense, if there is such a thing, shows it. So why are so many of you still against it? I don't understand. Explain it to me. Zang.
Today. See, I don't like I have, okay, like a lot of you, I hate a lot, you know? But I hate with style and creativity. Yeah!